Hi, if you are around 6 to 8 weeks into Bell's palsy and thinking, I can close my eyes if I really try, but blinking just isn't happening, then you're exactly where my people get confused, anxious, start imagining worst case scenarios. In today's video, let's clear this up properly. Because what you're experiencing is not just unusual, it's actually a very specific stage of nerve recovery. What you're noticing right now actually matters. The reason being, blink is not a voluntary movement. The fact is that you can close your eyes with effort, but you are not able to control it in subconscious level. It tells us one critical detail, that your nerve is even though starting to reconnect, the coordination is yet to come. But here's the catch. Right now, your system only knows how to do it with maximum effort and conscious control. Blinking, on the other hand, is automatic, fast, low effort, and perfectly timed between both eyes. And your system isn't just ready for that. So why blinking hasn't come back yet? If this is the question in your mind, let me explain you. Blinking is not just a muscle action, it's a reflex control. Here, there is a reflex loop between your brain and your facial nerve. Now, that loop is still being rebuilt. So what happens? You can close your eyes whenever you force it. The voluntary pathway wakes up and you see some movement happening around your eyes. But you cannot blink naturally because the automatic pathway is still offline. This is why it feels so strange. You have some control, but not the control that actually matters in your daily life. The usual sequence of recovery that will help you here is visualizing this particular flow of movement. Most people expect recovery to flip like a switch, which it doesn't. It follows a pattern. So, there are stages of blink reflex recovery. Stage 1 is where there is no movement. Stage 2 is where there are some flickers or slight contractions felt. Stage 3, where your movements are there with effort. This is where you exactly are right now. And then there are stage 4, where there is partial automatic movement, where there's some inconsistent blinking is happening. And then comes your stage 5, which is more natural coordinated movement. So yes, effortful closure usually comes before blinking. Blinking doesn't return perfectly overnight. Initially, it may look like delayed compared to other eye, incomplete, which is not fully closing, inconsistent, where that sometimes work, sometimes it doesn't, and slightly off rhythm. And honestly, that's what is expected. Your brain is relearning at this time. The brain learns in a step-by-step manner. So, the brain has to learn not only about the movement, but it also needs to learn about timing. It also needs to learn about sync, where both eyes, whenever blink, can sync again. In many cases, yes, significantly better synchronization returns. But that's not a similar case in every situation, as every individual is different. But here's the reality, which you need to understand. Perfect symmetry is not the first goal. Control and coordination come before symmetry comes back. The brain first will relearn how to move a weak muscle. How much to close it, when to close it, how fast to close it. Then it will refine the timing between both the sides. So if your blink feels wonky at first, that's not regression. It's actually a progress. So you should celebrate that. This is retraining in progress that's happening every minute, every single second till you recover completely. There is one biggest mistake that people make at this stage. And that is, they start forcing contraction more and more. When people realize that they can close their eyes, they start forcing repeated closures, squeezing the eyes tightly, over practicing the eye closure. And this can create one very biggest complication, which is called as synkinesis. Excessive effort patterns, tightness, early synkinesis like eye-mouth linking are some of the commonest patterns or problems seen when there is effortful practice of eye closure happening again and again. And this particularly happens because your brain learns that closing the eyes equals to using maximum force. That's not how blinking works, isn't it? So what you should focus instead? At this stage, your job is not to train harder. In fact, it's to train smarter and calmer. So make sure to focus on these things. 1. Gentle attempts of eye closure and not forceful squeezing. 2. Short holds but not prolonged strain. 3. relaxation between attempts of eye closure. 4. Letting the movement stay small and controlled over forceful contractions. So think of it in this way. You are not building strength here. Eye muscles are not for strength. They are for coordination. So you are teaching your system how to be more efficient again, the way it was before your Bell's palsy. What about taping your eyes? Well, if you were doing it before, please continue doing it right now, as it will help you to stretch the upper eyelid muscles. Nighttime eye protection is still important as it was important before. If you're thinking, shall I use eye drops or not? Absolutely, you should continue using eye drops. This will make your eye closure effortless and blinking more functional. So, don't rush to this part of practicing forceful eye contraction or doing more and more eye exercises. In fact, try and train your eyes to move more automatically and naturally. On the emotional sides as well, what you have said, I can't imagine it. This is also a real thing. That's something almost every patient feels at this stage. They find it impossible to imagine blinks because you have not seen your blinking naturally from a long while. When you don't see movements happening on your eyes normally, or even when you see partial movements happening on your eyes normally, the feedback that your brain gets is that the functions around the eyes are not happening normal. And that's why the mental map starts getting blurred, and your brain can't picture the next step of the right blink patterns. And that's where retraining comes into the picture. That uncertainty needs to go away, which creates anxiety. So friends, if you are someone who is suffering from Bell's palsy or synkinesis, don't delay. Reach out to us so that we can help you better.